Hello, Idaho, Montana Red Crossers. Nicole, Sirak, Irwin here. I'm CEO for the region, and just checking in with all of you to see how you're all doing and maybe share a little bit of good news that we're having and some great work that's happening. And I wanted to start off by saying thank you to our nurses. It's Nurse Appreciation Week, and as far as I'm concerned, we need to extend that for the next 100 years. We know that our nurses are always valued, but particularly during this pandemic. They are on the front lines. They are helping us with our clients. Many of us have nurses in our family as other medical staff. So we're just so grateful and want to make sure that our nurses know how much we value and appreciate all the work and sacrifices that they're making. A couple of things across the region. Many of you know we had quite a large multi-apartment complex fire in Great Falls, Montana, and it really tested our new protocols and social distancing and putting people up in hotels. And that team just did extraordinary work to wrap around those members of those families. You know, Great Falls, Montana is my hometown, and so I'm just so grateful, but not surprised to see the community really opening up their hearts. And there were restaurants that donated food. Albertsons and other great partners of ours helped out. This team really learned how to do this very quickly, very professionally, and we had so many grateful notes of gratitude from both the property manager and the residents. So thank you for really showing us how this can be done, and we're probably going to need these protocols and these procedures in the future, and you really showed us how to do that. So thank you to the Great Falls team. Here in Idaho, I have a story to tell. There is a staff member that retired with us a couple of years ago, but he dedicated his career to the Red Cross, and he was in the fundraising area, and he retired to a very small town in rural Idaho, and he had a house fire this week, and he got out thankfully, but just with the clothes on his back and a car in the driveway is about all he has. And we responded to that, reached out, and he just really wanted to make sure everybody knew how grateful he was to have fundraised, to support the programs and the work, never, of course, thinking that he would one day need those services. So just a great showing of how both in urban and rural areas, our teams are on the ready and doing amazing work. I also want to talk a little bit about our blood services, and we know that they are really actively working to make sure we maintain the blood supply, and there's some really exciting work that's happening with convalescent plasma. So those folks who have had the illness and have recovered, there's an antibody in your blood, and it can be used for therapeutic purposes for those who are suffering from the disease and help increase their healing time. And so it really is promising. It is showing to have some good effects. And so we're collecting here in Idaho, we're collecting in the Boise office, and then in Missoula and Great Falls offices. And we've had over 34,000 people across the country sign up to see if they are eligible to give, and we're filling those hospital orders. So something to be really proud of, and you all are a part of that. So again, I just wanted to check in with all of you, make sure you know that we're here for you. We're just standing by if there's anything that you need, ways we can support you. Continue to take good care of yourself. It's really becoming hard at these times, isn't it? It's happening. It's going a little longer than maybe we thought. I know I've had days where I've just not been at my best self, and just reach out to this wonderful support network that we have here. We're here, and we're waiting to see how we can work with you and make sure you have the best experience possible. So thank you again for all you're doing, for being a part of the Red Cross family, and please keep in touch and let us know what we can do to help you.